The perennial health workers' troubles, which have led to situations such as industrial strikes and untold suffering among Kenyans, is among the main reasons why the universal health coverage by 2030 dream may not be achieved. This is according to various sector stakeholders who cite the health workforce crisis, which currently faces many challenges such as shortages due to unemployment, lack of motivation and brain drain. Mercy Chelangat was at the second and final day of the 2025 Nation Health Summit and now reports that health experts weighed in on how this affects the fulfillment of universal health coverage and what can be done.
The queues, the wait, the trip to the treatment room in many instances almost mirrors the journey to achievement of universal health coverage. It is a long, painful one. The lines are in many instances a reflection of the wanting capacity on medics at the facilities as a result of the less than desirable situations regarding healthcare workers.
The issue of human resource is in a catastrophic situation. And why are we saying this? Because number one, we have big shortage of doctors, nurses, and all healthcare workers in entire country, in all the levels of the hospitals. And that's why we have many patients go to the hospitals and taking long waiting hours of up to 24 hours. We have health workers who have trained, but they're not getting employed.
The medical workers' unions have again raised the concern of Kenya's loss by way of brain drain, which they believe to be avoidable.
The reason why health workers are leaving is, number one, is the poor wages. The CBAs are not implemented. Number two is that there's irregular promotions. They're not being promoted. There's no motivation. They're not supported in the hospitals to do the work that they expect to do. There are no drugs, there are no equipment, there are no diagnostics.
Clinical officers here in Kenya are 30,000 and counting. The ones who are in formal employment are only 10,000. 6,000 in Kenya in government and 4,000 in private sector. The remaining 20,000 I can tell you for free. 3/4 of the remaining 20,000 have no formal employment. They even fear going to do those locums, where you are paid 500 shillings in a day. You work from 8 to 6 p.m.
However, not all is lost. Vision 2030, which envisaged that there would be an industrious middle-income country where Kenyans can live in good health and have a better life expectancy, can still be achieved by preventing healthcare worker migration and focusing on primary prevention of diseases.
We need an investment case from the Ministry of Health that now quantifies the medical tourism, the equipments we need, the investments we need to put into training, to train super specialists, the investments we need to ensure that we meet our staffing norms and standards. How much does that amount to? So that then, because that is the executive, they take that budget and they take it to Parliament.
The biggest answer that we have in universal healthcare, a larger percentage of the answer lies in primary prevention. We know that 70% of the cancers would have something to do with smoking. It would be important for us to have an intervention that's directed towards smoking. So it is a conversation which you cannot have without looking at primary prevention.
As the Nation Health Summit comes to an end, the question is no longer about whether Kenya has the potential to achieve the universal health coverage, but whether it is willing to make the hard and necessary choices to get there. Mercy Chelangat, NTV.